Hi,
Hey, what's up?
how are you guys today?
Not too bad. How are you?
I'm all right. I'm sad that it's dark in the middle of the day now.
Oh yeah, it's true. But the 1 hour was 1 hour extra sleep for me, so that
True.
was nice. Yeah.
That was very nice. All right, so I'm going to talk about when Nadia is ready to buy her first house. So she's about 35. Share my screen. Can you guys see that? Cool.
Yeah.
I'm going to present. All right, so yes, her house, she's buying her first house. And I kind of want to dive in a little bit about how your health outcomes are affected by your zip code, but more specifically, how your food and nutrition outcomes are affected by your zip code. I know that there was a ghU already done on this topic, on the topic of food insecurity, but I kind of want to dive into how social injustice and food apartheids kind of tie into our food system and how that plays a role in where you live or where Nadia may live. But before I kind of dive in, I will ask, do you guys have anything that stuck out to you from the food insecurity ghU? Anything you remember? Any knowledge you want to contribute? I don't want to put you on the spot, so you can just like say no and I can move on. That's fine.
I mean, the main thing I remember is like how much food is wasted. Even though a lot of people can't find food in the first place. Yeah.
Yeah, which is really crazy, and has a lot to do with how food deserts are like play a huge role in food insecurity in our population. And I will move right into that if no one else has anything to add. Okay, so some key terms. Just as I said, food desert, it's basically an area where people don't have healthy, affordable options because there's not a grocery store within walking distance of where they live. And SNAP, which is a federal supplemental nutrition assistance program that provides food purchasing assistance for people with little or no income. So just some terms that were mentioned before, and then I just kind of want to build off them. So it's just good little refresher. So jumping right into how social injustice plays a role in our food system, do you guys know what determines your lifestyle? Like what components? Do you have any idea on that? I kind of have some pictures down there if you need some clues. So, the important things that determine our lifestyle are often referred to as the social determinants of health. So, that would be the safety of your environment, your family and friends, your access to healthy food, your education, your income level, and if you're employed or not, which I know that GlobeMed always goes back to and is really awesome to talk about because it's kind of the foundation for a lot of the discussions that we have. But the social determinants of health are super important in predicting your health outcomes. Is actually 60% of our health is related to the social determinants of health. And actually, your zip code plays a larger role in your health outcome than your actual genetic code does, which is really wild. And unfortunately, our food system plays a huge role in the structural violence in our food system that hurts minorities, the poor, and food insecure. And structural violence, I just mean social, economic, and political factors that determine disease. And people who often live in these areas where, it may be a food desert, they don't have access to healthy food, are going to be at a higher risk for suffering from cognitive and behavioral problems, violence, suicide, homicide, chronic disease, premature death, mental health problems, lots of like very dangerous and terrible things, which at large could affect Nadia depending on where she's from or where she's moving to. But a more specific example I can provide is if Nadia was a part of the Hopi indigenous population, her ancestors had no um, there was no high probability of them suffering from obesity, type 2 diabetes, or alcoholism. And now 80% of the people have diabetes by the age of 30 and a life expectancy of 53, which is largely due to the fact that they were pushed under reservations. Their water resources were usurped because the river that they got their water resources from was diverted to other cities in California. The US government actually killed over 60 million bison, which completely eliminated their food supply. And then they sent them commodities like white flour, white sugar, and shortening, which basically inundated their body with a lot of starch and a lot of sugar, and made them predisposed to obesity and getting diabetes. And this is a very clear form of internalized racism that is especially pernicious because this population largely doesn't have the idea that it's an issue that needs to be addressed and it needs to be changed. Also, side note, if one of you guys would be willing to let me know when it's time to change, because I can't see the banner, so that'd be very helpful. Thank you. Okay, so moving into food apartheids and how that plays a role in food insecurity. So what is a food apartheid? First and foremost, embedded social and political form of discrimination that recognizes that areas of food disparity do not occur by naturally. More specifically, we can kind of describe situations like this with the words food deserts and food swamps. I know I kind of already went over what a food desert is, but a food swamp is basically a community that has a lot of fast food or like bodegas that push unhealthy food-like substances onto people, and they don't have any other option other than to consume this food. And unfortunately, it's becoming an increasingly popular term to describe affected communities just because of the fact that there is that overabundance of disease-producing food or substances that have a lot of additives and are addictive. And unfortunately, the highest rate of obesity, diabetes, chronic disease are found in African American, Hispanic, Indigenous, and poor communities, which is yet again another example that food is an internalized form of oppression that disproportionately affects these populations. And how this kind of ties into food insecurity is that even when food is available to disadvantaged communities, fresh whole foods that are healthy for you are very expensive, and it leads to the purchase of cheap, unhealthy junk foods. And oftentimes, poor communities that don't have the resources to buy these healthy foods, they just need to feed their family in the most inexpensive way possible, going paycheck to paycheck. So that obviously is an important factor that affects them. But kind of ending off on a more positive note, how we can affect change, hopefully, in our food system and all the issues that it has are there's many different ways. It comes from many different platforms and people. But oftentimes the people who are living in these situations don't really fully understand that they are a victim of food oppression, food apartheid, and internalized food racism. So again, it must come from many different avenues, like changes in government policy, which happens at the local, state, and federal level, regulation, litigation, healthcare reimbursement for food as medicine, nonprofits creating local programs to educate and empower people, and then grassroots efforts of citizens working together with their communities to regain food sovereignty. And I think this kind of goes back to the important principle that we, as a healthcare system and as just a nation, need to shift the perspective from blame the victim to change the system. People suffering from a lot of the things that are a result of the food system affecting them in that moment, that's not their fault. And it kind of, I think it also relates to preventative versus curative care and making sure that we have food as medicine. I think that's very important, especially for doctors to be promoting that. So that's kind of all I had on food insecurity. I'm not sure if you guys have any questions or any ideas. I don't know how much time is left. Have they put a...
Yeah, they put like a switch warning, but I thought it was an awesome presentation.
Thank you.
Yeah, really that deep. Yeah, I learned a lot. Really awesome presentation.
Thank you. Do you guys have anything exciting that you're looking forward to this week? Any fun Halloween? Oh, hi, Anish. Okay, it's time for me.
No, you're good. You're good. You're good.
I care about your guys' answers, though. Okay, time to go.